Welcome to Physios on the Mic, brought to you by the Australian Physiotherapy Association. I'm Sophie Shepherd.
And I'm Matt Farr. We'll be your co-host for Season 2, Pain in Practice.
Welcome back, everyone, and we are very, very excited to have with us for this episode Dr. Peter Roberts. Peter is a specialist musculoskeletal and titled pain and sports physiotherapist with quite a few decades of experience now. How many years are we up to now, Pete?
We're up to 51.
just a couple of years of experience there. Now, Peter has had a lot of experience over these decades. He's worked across a lot of diverse settings, starting his early career with working under Geoffrey Maitland as an early grad, and then going on to work in sports, supporting athletes at lots of different levels, from local cricket and netball teams all the way up to working for national netball teams, as well as the track and field at the Sydney 2000 Olympics. He then went on to develop a passion for helping those who are a bit stuck in their recovery and proceeded to delve into the space of persistent pain, founding the Paragon Pain Program in 1999 alongside two psychologists. And he's been very active in the educational space and supporting the profession, having taught as a guest lecturer in the undergraduate and postgraduate physio programs at the University of South Australia since 1980. And he currently lectures to physios in complex pain management in the Master of Advanced Clinical Physiotherapy Musculoskeletal program. He wrote and delivers the Advanced Clinical Pain course, which is soon to be the Pain Level 2 course for the APA, and is an active member and volunteer with Pain Revolution, where I was very privileged to have him as my Pain Rev mentor. So I struggled to fit a succinct bio in there, Pete, because you've been very, very, very busy, many hats there. But thank you so much for joining us.
Pleasure. I'm really excited to be part of this podcast, and hopefully I can influence other people on their journeys to really get on their bikes and enjoy it and go forward in curiosity. I'd have to say that I was thinking about the podcast and thinking about what sort of things have driven me. It's curiosity. I really want to know more. I want to understand what was going on. And I was very curious about people. They're very complex. And I guess as my career has evolved, I've got more and more interested in people and their stories and the complexity of the individual, and discovered that the individual is the key in how we go about things. We're struggling to show through RCTs, what really works best, although we're getting closer. There's more studies now targeting down to individual, if you like, packages to match the individual's needs and the tools they need, and it's still complex. It's hard, and so we're still not getting the great data we were hoping to get, but we're getting much closer. I guess Peter O'Sullivan is leading the way recently with his CFT 3-year outcomes, but also Laura Mosley's had several projects that have been demonstrating some good shifts, and it's really lovely to see. And it's just adding more magic to our toolkit. So I'm really glad that these guys are out there really putting their feet forward. They're both passionate and driven, and I'm really pleased to be part of Loz's Pain Revolution. The culture there is something I can't describe, and I feel very privileged to be there in that group.
Amazing.
Oh, awesome. Thanks, mate.
I think the other big thing is don't stop learning as a physio. I've done every course that I feel is relevant every year, every conference. I love to learn, to hear, and there's always gems that you can take home with you. And part of it's the gems of catching up with people and sharing ideas. I really loved mentoring you, Soph, because you're so passionate. And the danger was that I was quite passionate as well. So we tended to go pretty laterally at times, which was fun, but you always come back to the center, don't you? And that's the enjoyable part about teaching and collaborating. It's, the more you give, the more rewards you get, really. And I do like that part of that.
Absolutely. And I think, because we know each other pretty well, Pete, and we've already spoken about, really, I guess, the complexity of individual people. And I know that particularly Matt, who's not really met you before or had the opportunity to meet, I know he was really keen to hear a little bit more about, I guess, your journey. So Matt, what jumps out at you? What do you want to know about Pete?
I feel like you are all over the place kind of thing. You talk about starting in sports, which is, I feel like that's every physio as they start out. It's like, oh, I want to be that sports physio. So,
Yeah.
that's where I'll start. And then you move on to more pain programs and understanding more complex pain issues as well. Maybe we'll start simple. And what kind of drew you into physiotherapy? Because a man of your skills, I feel like you could have done anything, really.
Thank you. Look, it's a bit of a journey, really. The fascinating part is, as a young boy, 11-year-old, I fell off a super stack and it was about 3 meters high. And I really hurt myself. I still remember that. I couldn't move for about a week and I was on a farm and I sort of had a chronic back from then on. Really never understood it till quite a few years later. That led me to be interested in the body, I think. And then my grandmother had quite severe rheumatoid arthritis. And I remember the physio, and by that time we'd moved over to the city because I was at college. The physio used to come in and the physio was like a godsend to her. It was her only hope of movement and relief. I thought, well, that's a really special job that physio is doing. And that really motivated me to get into physio. Initially, I struggled to get in because actually I don't have a mathematical brain. Like I got the ancient history prize, but I was always bottom in the class in maths. and in my days, you had to do a science pathway. Everyone did, maths 1, maths 2, chemistry, physics. And none of them were very strong for me. So I had to repeat year 12 to get into physio. It's been a really wonderful journey. Part of that too was that I was quite a high-performing athlete myself. I was playing quite a high-level tennis. I was running cross-country competition. I was playing a lot of sports. I love sport.
Right.
And so I was very intensely interested in sport. So that's where that started. And I think my interest in sport was from a scientific basis, and I wanted to understand more as a curiosity coming through. And then when I finished the physio degree, I was really lucky in that in my day, you could actually, if you were with the public hospital system, the Queen Liz, they would actually sponsor you to do the advanced manipulative physiotherapy course. There wasn't a sports course in those days. It was all about manipulation. Geoffrey Maitland had led us into the world of moving from masseurs into, this whole clinical reasoning approach. So, that was just such a wonderful time because Jeff's clinical reasoning, all those principles are still all there today. The core of how we reason and unpack people. And he would always prove what he'd done. Did it work? Did it change? Proving, negating all the time is exactly what it's all about. And that led me into that world. So at the same time, I was still having a very heavy sporting career and looking after state netball and local district cricket teams and really involved in that. But when I was at Jeff's practice, he had a very high manipulative hands-on approach, which I did as well. I was manipulating probably to 8 to 10 times a day. Usually have about 20 patients in his practice. But I found there was a group that just weren't responding. And so I said to Jeff one day, do you mind if I keep these patients' stats? I'd just like to unpack them. And I gathered about 100 of them over about 6 months. And they had some very common themes. They all had their problem more than 3 months. There was usually some sort of trauma, psychological stress going on. And that led me on that other pathway of trying to understand this group. And because actually they end up being the main ones that you have on your list because the sports ones all get better. You just got to get them in a good program. They're going to recover. They're driven. They've got great immune systems, usually motivated. And then there's the chronic ones. And then, there's that psychosocial domain that seems to be high. They're usually stressed, depressed, lost their identity. And so, you're in that world of chronic pain again. It sort of started from there, really. And, sports careers are not good for families. You end up being the athlete before and after and during. And so I did sort of make a conscious decision to move into a more family-orientated pathway because, you just can't have a family being in an athlete world very well. So that was motivating me a lot to move out of that world. I mean, I would have loved to have done a lot more international sports, like, or even other Olympics, but it's a big ask. And if you are, you've got to follow the Olympic team that you're assigned to, and go around with them. So that led me away from that. But, I did do a lot of things in that. I was running basic and advanced taping courses. I actually went over to India before their Commonwealth Games, and we taught the Indian physios how to do taping techniques. And I was teaching that at UDSA as well, so it was sort of a part of that already skill set I had. So, yeah, it was quite good. And I used to run taping workshops for physio students at my practice, and the school would send them down to do it because I didn't teach at the school. So I really loved all that, and I'd get other physios heavily involved, and, it was quite good. My practice was quite big. I had up to 10 physios there at one stage, but we had a very strong commitment to having a year apprenticeship for physios or mentorship where they'd have to sit in with a physio every week. They'd be on a 3-month assisted sort of building their skills pathway, and we never had any trouble getting physios, and they were really good physios. They knew who was offering good training and good opportunities, so we're always lucky in that way.
Pete, is it okay if I come back to something that you mentioned before when you were sort of starting earlier on and you were working in that sports setting and noticing these people who were just stuck? Because I feel like that's an experience that I think most physios who are listening, and I know myself, have had that experience of sort of coming out with all these skills from uni and going, right, I'm ready to help solve the problems of the world, and then feeling like you're just hitting a wall sometimes, and you sort of realize that maybe there's more to this than what I'd thought, and I need to, upskill, or I need to seek out more information so I can better support people. And I mean, the landscape now is very different when we're talking about pain science and pain management because, you already mentioned Lorimer among, many other researchers at the moment. There's a lot more resources and education now around pain, but I'm interested in what that was like for you early on, because I can only imagine that there was a lot less in the pain space available at that time. How did you go on that journey, and what was your learning and exploring pain more? What did that look like for you?
You're absolutely right. So there was very little out there. I remember I had an awakening when I went to one national, I think, APS conference, and there was a guy there, I think it was Philip Seidel, and another guy did an article about this whole thing of central sensitization. And it was like it suddenly made sense. There is another mechanism. And so in those days, it was only nociceptive and neuropathic. And nociplastic, we know, is a new entity relatively, but because these people are often sensitive, and they're often protected, and there was always psychosocial stressors in there. That was a big awakening for me, and that's when we started really working on the pain program idea. It was a really funny story that started me on that. What had happened was I had this lady who came in with all this spasm in her back, and she was locked up, and I had a bit of a reputation. This was about the 1980s, I reckon. I had a reputation for being good with my hands. She came in, and I manipulated her. She straightened up and could touch her toes. Oh, that's wonderful, And I gave her a few little things to do. She came back about a month later the same. So I went through that, asked what's going on. No, nothing. No, I can't work out what's going on. And anyways, did the same. Yep, great. 2 weeks later, she's back again. And I could just detect there was all this stress in her body. People in those days were really scared of psychologists. They really saw it as in my head. Look, you've got all this tension in your body. I think we need someone to help us try and lower this. And psychologists are experts. And she bought that idea. And so I referred her to this lady who I'd come across, who was Maria Polymenaeus, actually, and she was the one who I helped to co-found the pain program with. But to cut a long story short, she went to see Maria and I didn't see her again. I thought, I wonder what happened. So I rang Maria and I said, I was really curious how you got on with this lady. She said, it was simple. I just told her it was okay to have an affair with a minister and to leave her husband. And so, that was the whole problem. But, sometimes people won't open up to you. So you definitely need your colleagues to, help you sort of unpack these things. And, time and time again, I do find that you'll unpack stuff. The psychologist, how'd you find that out? And then the psychologist, didn't realize they were hurting themselves like that. So, having that interdisciplinary team really struck home at that time that you need your colleagues collaborating, because we do tend to work in islands and always look for opportunity to reach out and have a chat. You get so many surprises and so many helps, and it makes your career much more enjoyable when you're collaborating with others.
Wow, that's certainly a story. I think that tops all the stories I've ever heard before. You mentioned starting a pain program. I guess, what was your criteria? What were the things that you found that was essential that people must know to help manage their pain when making a pain program?
It's a really good question. I'm thinking about that. I was always curious about, what really concerned people most. And it surprises me what they did want to know. And the way that I came across that was when people came into the program, we usually sit them down in this group and we say, well, why are you all here today? And we do a brainstorm on the whiteboard, of all the reasons over there. But, most of the time they didn't mention pain. It's usually my life shit. I hate this. It's ruined my marriage. I can't work. I've lost my identity. They don't talk about agony and pain. And I was really fascinated by that. But, they sort of seemed to open up because they felt everyone in the room was on the same page, and they didn't even think about the pain issue. It's just how much of the rest of their life had suffered. And that was a real eye-opener for me to really get on my bike about, I need to understand people a lot more. And in that space, I did a motivational interviewing course, and that was one of the best things I've ever done in my career, because it taught me how to have conversations that allowed them to own and have permission to take control. And it's such a powerful gift, and I actually went on to run some motivational interviewing courses with a psychologist for a few years there as well. I haven't pursued that because it's not my dream to be doing that. I'd rather be teaching physios about chronic pain, but it taught me so much about that relationship building. And it's something I do a little segment on in the Advanced Pain course, because I think all physios, you could call it motivational interviewing or interviewing skills that help them own and, if you like, take control of things, discover how can I go forward and get my life back.
I agree. It's such an important skill for us to have. And to be honest, I'm kind of a bit amazed that it isn't the foundation of a lot of our communication skills even now, because I know for me, when, I did an MI course a few years ago, and I had a similar experience. I found it so drastically altering to the way in which I sort of approached practice and the way that I thought about even just the structure of the consult, and almost how can I get my own agenda and my own ego out of the way so we can actually get to the person who's in front of me, which, sounds strange to say, but, we don't realize how much we tend to center ourselves as clinicians a lot of the time unless we're consciously thinking about it. So yeah, I would agree with you totally. I'm really interested actually, Pete, though, you had this journey, this transition, from doing a lot of sports work early on and then moving into this sort of complex persistent pain space. And I know you drew comparisons earlier about how, many sporting patients do tend to recover and get better and, maybe are a bit of a different presentation. But I'm interested, with all that you've learnt going down that journey of venturing into the pain space, when you reflect back on the sporting context and sort of some of those, sort of athletic populations, are there aspects of the pain science and pain management that you still feel are, really critical, or that you sort of still use in that sporting context, or that you see as being really important, even though it's maybe not traditional pain management sort of setting?
Absolutely. So I still see quite a few elite sportsmen treating a couple of state one squash players at the moment, and I've seen a lot of runners because I was running courses for physios, and so the physios still refer me complex running injuries, but also my name's still out there a bit, so I'm often in the back lane assessing running and or squash or tennis. So I do have a big interest there. I mean, In my lecturing and teaching at uni, it was on rehab of movement analysis and training, and that started from Shirley Salmon. I thought she was gold when I first met her because she didn't actually start by looking at people from the objective movement base. She started looking from how they moved. Well, it hurts when I get out of a chair. How do you do that? And then she just changed it and, oh, that's better. And, she would go to that level. So with athletes, I go to that space a lot. When does it hurt and how did you do that? And, it's often breaking down with video analysis, but also getting into the detail underpinning that, the flexibilities. And there's also a big group with chronic recurrent pain. There's one squash player in particular recently he's had a bit of a chronic body all his life. He's quite an anxious, stressed sort of personality. And he developed this really funny pain that didn't make sense. It was sort of going from his elbow up to his shoulder, when he was trying to hit a high smash, which he says he always stuffs up. So we started unpacking that, and he had some sensory sensitivity with pinprick. I actually got him to do the recognised program, and he was really low for a squash player. That was really unusual. Like, he was only getting 60% recognition on the recognised. And then I put him in the mirror with the other arm doing a smash, and it brought on his elbow to shoulder pain in the other arm. So, that was really exciting, and he liked the label, oh, this is the dysuria phenomena, like he liked the diagnostic label. But he turned it around within 2 weeks. He did mirror training. He realised it was in his system. So he did the recognise. We did some sensory acuity training. And he got rid of it, and he's now playing number one state one. So, but before that, he'd been down at two or three levels because of this confidence issue with his arm and elbow. I got another squash player like that as well, who was going to give up when he was in state four with chronic knee, groin, ankle, and sort of wandering pains. And again, he's a really smart personality. He's an actuary, which is all into stats and detail, and managing super funds and stuff like that. And he's actually a huge advocate for me. He's so good now. He's in state one as well, and he's in his late 40s but still winning. He's a very good patient though. He's very obsessive, so anything you give him is good, but you've got to be careful because he's a typical boom buster, so you're constantly talking about the sweet zone and pacing, but he's onto it. If you give the detail, he's into it. So I really enjoy those because they have a lot of energy and the motivation's big and the results are good. If you get them on page, that's a lovely part about practice. In a way, it's funny with people who often talk about, oh, I can't do the housework, oh, I can't do my gardening. I say, oh, let's turn this into a gym. And so build a bit of a gym program. And it sort of shifts the context. Like, if you can get fit in this gym, you've already got it at home. You're ready for anything. You're fit for purpose. And that's Loz's model a bit, fit for purpose. So find the things that are relevant and meaningful that you value, and then, you're into it.
With your examples that you've given, it sounds like you were helping them explore the biopsychosocial model without kind of making that more explicit to them to get that on board. Is that right?
Yeah, it is. It's interesting. The big thing is to be listening and being present, and silence is actually helpful for them to contemplate because it's saying, I want to sort of sit with you on this and I'm curious about what else you're thinking. The guy had the elbow to shoulder pain, had long-term anxiety and has seen a psychiatrist, and I never delved into that because I could tell he was very private about that. I sort of knew just from some things that have been said. He's now opened up right all up about it, and we'll often, when he comes in with another injury or whatever, we'll talk about, what sort of stress he was under, how was that affecting his performance on the day. And he's got really good at body scanning and breathing and using techniques on the game time, particularly if he's got a really hassling, challenging player that he's trying to work with. But you're right, Matt, there's always psychosocial domains, and it's actually making sure you're working in their comfortable space. That's the thing. And I think, just using simple language, or how did you feel about that? Or did that affect you in any other way? When you're under that pressure, what happened. You remind me of a lady who I've seen a few times on and off, and she recently just had a flare up of her back and couldn't move. She's my art teacher, actually. I'm in this masterclass art class. And I was at the art class with her on the day, and she said, "Oh, I'm really struggling with my back. Can you do anything?" She'd sort of sent me a text that she would be struggling, so I took some tape with me just in case. Initially she thought, I bent down to do up my shoelaces, and I think I've strained a disc. And I said, "You just need to do up your shoelaces, and you know how much stress there's." So I guess it's not a lot of doing it all the time, don't I? I said, "Yeah, well, what else was going on?" Oh, she said, "It was like a light bulb. I had all these student exams and there's a lot of stress." And we went through that because she's a lady that's had like an autoimmune chronic pain type thing. And we talked about her immune system and stress. And, she sort of suddenly let go of it all in a way, like, "Oh, I'll be okay." So pain can really push people into this protected worry stress zone, and then that becomes overwhelming to the stage they can hardly move. Yeah, I'm very much into this world of how can you boost your immune system. I see a lot of people, I talk about the bioplasticity of that, and how chronic pain, although you might have some genetic or gender predisposing factors, you can work the genes around if you get active enough and fit enough and enjoy your life and do things you love doing socially.
It's such an interesting area, delving into the research around epigenetics and the nervous immune endocrine ensemble and all of the, really dense sort of pain neurobiology research that's coming out. It's so fascinating. I do have one question for you, and I am very conscious as I ask it that it has potential to be slightly controversial. You talked a lot about your early career and how, you really started in that hands-on manipulative sort of therapy space. And I think the thing that's been fascinating for me is to see all of these discussions sort of emerging say on LinkedIn and professional channels and social media. And it seems like there's these two camps. You've got, pro manual therapy, and then you've got, your pain therapists. And if you look at what you're seeing online, you'd think that it's such a stark divide between pro and anti manual therapy. And I'm interested in your take on that, because I think my suspicion is there's probably a lot more nuance in the middle there. But I'm interested in your experience, and from the years that you've worked across a range of spaces, how do you see manual therapy these days and how it sort of fits within or alongside pain management? Have your views changed and evolved?
Look, I think it's back to the individual's preferences and what they like. Some people's physicality is a dominant thing and they want to be manually made to feel nice, to feel you've given them some instant relief. So I think manual is always there. It's part of who we are, really, and psychologists often say, we can put hands on people. I can't, and it's such a gift because people do like to be touched in pain. It's soothing, it's relaxing, and but there are lots of situations where manual therapy can unravel frozen shoulders that have become stiff in their later stages. The evidence for early stage isn't there, but certainly in later stiff stages, and we see it over and over again, particularly in protected states. Look, I think it's sad that people are making such a dance about them and us. I think it's always them and all, us and all. One of the things I do with every patient that comes in, I spend a fair bit of time around their expectations and understandings as my starting point. I'm surprised how many people say, look, I just want some good exercises. So I've got a few people who come in, can you just do some hands-on? I don't need to know about anything else. Fine. I think you have to be adapting to that individual's view of what they see. Frequently, though, if I see there's more than that and where there's a recovery, I'm into nearly everyone can recover unless there's a disease or an autoimmune condition, some, serious inflammatory disorder. 90% of people can recover. I'm always looking for the pegs that put that in their toolkit that leads them to recovery. So I love the Peter Moore UK 12 tools, and I love the Pain Health website that I love. the Pain Revolution, Pain Facts. I love Peter O'Sullivan stuff. I tend to send them wherever their problem, if you like, seems to add a bit of nit. And, the Pain Explained Pain book is a great book. It's got lots of stuff. It's a bit complex, but you can really pick out some good stuff in there. And, the basing and goal setting on the Pain Health WA website is treatment. If you do it like this, you base it and grade it up, you'll get better. There are lots of, gems of information you can give people, and it's also picking the right amount. Some people just need a little bit, other people need a lot, so you've got to be prepared to work with people's hunger and interest, for that information.
How do you get around or encourage someone who feels like, I guess, talking to a patient is not necessarily therapy or treatment? I know you did highlight that it is treatment, but how do you convince a therapist or maybe help a therapist understand that, we need to be talking to our patients and using, the psychologically informed kind of speech?
I think it's like building a friendship, it's around listening, building trust, understanding the inner workings of that person where they really feel like he understands me. I had one today who just felt she didn't sync with the psychologist, like she doesn't get me. And she was really upset about it. She felt guilty that she didn't get the psychologist. And I said, well, it's like friendship. And there's some people you just don't get. It's quite okay. There are plenty out there for you. There are, like you found in your life. A friendship is 80% of the treatment, I believe. The treatment is about being heard, being understood, and then I can do this. I'll tell you another story. I had a guy out at tennis. I play competitive tennis, and this guy, a young guy, was playing one of the top players. He was running everywhere, and it just looked like an injury ready to happen because he was so fit. He could chase everything down, but he wasn't such a good player technically. Anyway, he went over on a crack and he was on the ground. So I was having to be there. I went out and his lateral lower fibula was swelling up quite rapidly. So, it was really sore. And I did some tests and I said, oh, this looks like your fibula. I checked out the lateral ligament and it was hardly tender compared to the fibula. So I taped him up and we helped him go. I said, look, I think you need to go to the local sports clinic, see a doctor, decide whether you need a scan, but you might need crutches for a few days and, just make sure the fractures are aligned and, because they're all quite different. I said, look, it's not your main weight-bearing bone, so you're sort of safe, and some people don't have a fibula, so I wanted to reassure him that this isn't too bad, but, we keep an eye on it and manage it. Anyway, I rang him 2 days later. I said, oh, did you get a sports clinic? He said, oh, no, I decided I didn't need the sports clinic. And he said, I'm slowly getting better. And, like you said, it'll probably take a couple of weeks. And, he said, I'm pretty happy. The swelling's still there. It's quite tender to the touch, but I did the same taping technique you did, and it seems to be really helpful. And he said, I'm limping around and getting better. I said, oh, okay. That's the other extreme of someone who's just totally taken ownership and, I can manage this and I'm safe. And, he was always going to do well. He's a resilient, sort of adaptable personality. So, I think as physios, back to your question, Matt, I think we still got to do our job. Assess, look, give your opinion, because in that first assessment, you can't always tell what people are going to do, how they're going to go. He was, for example, someone who did really well, and you get someone else who's gone home to bed for 3 days. But he was always probably in that group that was going to do well because he's active, he's driven, good at decision making, and probably a bit risky, what some would say. But that's how he was playing it.
Yeah, wow. I feel like a common theme for you, and it's something admirable. You always want to connect with people. You said friendship's like 80% of the treatment. It's almost like all your research and everything is just the icing on the cake that you've done. I often think if I can know more, then I can explain better or I can do better. But perhaps I need to take a step back and who's this person right in front of me? What do they need right now? And a wholesome approach.
Yeah, good point. It is such a challenge in what do they need right now and how do you unpack that? I think you can unpack that. I often get to the end and I say, well, what what do you take away from today? What do you think happened? I'm actually a bit disappointed sometimes because, I thought I was offering a bit more than that. But, I wouldn't say that to them. But then they come back and they've reflected a bit and they've taken on a lot more. And I came back with one lady who I wasn't sure how much she'd taken on, and she'd written 3 pages. She'd been to all these places. She'd written down everything. I feel so much more in owning this now. She'd had a lot of other physio, hadn't done well. There's a personality factor there as well. So we're still in this juggle. It is complex, and it gets more complex when you have other stronger psychosocial factors like personality disorders, post-traumatic stress. There's so much juggling with their highs and lows with those issues. It's such a perseverance sort of pathway because it can be like this all the way, but eventually it seems to gradually wind back and they get it, and they take ownership. They're on their personal journey often with their pain journey, sort of, if you like, dancing with that, often in a negative way. So, be patient. And, something I always do at the end of my sessions is often say to them, oh, when would you like to come back again? And they look a bit flawed. Oh, when do you think I should come back? I say, well, I'm really flexible about it. What do you think you need? Because I want them to own that idea of I'm managing this, so I'm in control. And I'm also testing that hypothesis. Are they ready to own it? If they're not sure, I say, look, I'd like to give you 2 weeks of playing with these ideas and see what you can do with it. Sometimes I get to come back a bit earlier. So I'll often get them back a bit earlier after the first session because I want to make sure they've taken on the concepts and, we need to fine-tune things a bit. But it varies a lot, depends on lots of things.
I think one very, very clear message I'm getting from everything that you've said, Pete, is just how important it is that we can actually sit with and connect with the person in front of us, but importantly, really tailor what we do and the tools we use to their person and their presentation and their needs and their goals, because there isn't a one size fits all, and it's about us giving them the space so we can explore that together and go, well, what is going to work for this person and what can we pull on? And I think that's just such an amazing place to come at physio from. I think, that's such a powerful thing. You spoke about, I guess, asking patients their takeaways from a session and, what have you learnt in this session and what are you taking away from this session? I'm going to take a page from your book, Pete, except I'm going to flip it a little bit. And I'd like to ask you, what are your takeaways from the session? If people who are listening, if you were going to give them, 1 or 2 key things to walk away with, or maybe one bit of advice from the conversation we've had today, what would you like people to take away from today's session?
Take kindness to every patient. Kindness is really a joy, and come across a few people that work on that motto of kindness, and it's actually magic. And you'll hear patients talking highly about physios, and you know that technically they're not very strong, but they just love them and they'll do anything for them, So kindness is a real gift, and it just rewards you back every time and makes your practice and life lovely, really. So I'd put that first. And curiosity. Be curious about everything because it means that you're giving them complete control of conversations and leading them to ownership of their problem. And that's very rewarding when they do take ownership. I mean, I love it when people say, I don't think I need to go back for a month. I think I've got the tools. It's like, yay. But I mean, the problem for a lot of physio practices is the business model. And there's a real conflict there for them because, you do need to get turnover and return visits. And I get that. You can still do your stuff in shorter sessions, but it's harder work. And I think more frustrating work because you're not able to form such connected relationships and shared therapeutic relationship as much as because, even if you've got a 20-minute consult, I know some practices work on 15, but 20 minutes is still 5 minutes in and out to stay on time. And so you've got 15. 30 minutes is also hard in these complex ones. In South Australia, you can get restricted consults where you can get an hour. Use it every time. It makes your work so much more enjoyable. And if you can become a specialist physio, it's a joy. I have an hour with every patient, and often with follow-ups, I'll have our consults. On the whole, I see a lot of complex patients within 4 to 6 times over 6 months, but I'm usually involved with a physio practice doing gym or an exercise physiologist. I've usually got a psychologist there. We're touching bases. We're using shared goals with the other practitioners, and particularly a lot of their program is goal oriented, with finding sweet zones and pacing and grading and developing the whole package. So, it's a tough world for physio practices now because the overall expenditures have continued to go up. The physio returns from compensable bodies and from the general public has not gone to the same degree. So I do feel for them. But if you want to really fly as an individual practitioner, do the specialist training gold program in whatever field you love. It brings in that time and I guess control over your income, which I think is really special. We've got the advanced clinical pain courses coming out next year, so there's going to be opportunity there if people wanted to hear what I do. But I work closely with a guy called Alistair Flett. He's a really fantastic practitioner as well, a specialist physio. And look, there are so many good specialist physios out there. There's a whole pain especially go on now. There's heaps of really good musculoskeletal and sports physios, women's health physios. They're the main groups I work with, and I'm sure there's others in neurological and thoracic and other areas as well.
Pete, thank you for giving us your wisdom and sharing your time. It's very much appreciated.
Thank you, mate.
And we also do need to thank our listeners as well. Thank you, listeners. We hope you've got a lot out of this. I know I have today as well. And you can also check out our additional episodes by following Physios on the Mic on your preferred podcasting platform. So thanks for tuning in, and we'll catch you next time on Pain in Practice.
Thank you.